This is an instructional video on the removal of an indwelling catheter. The first thing I'm going to do is I'm going to check the patient's chart and verify that the physician does in fact want this catheter removed, and after checking it looks like he does. So I'm going to go ahead and grab the supplies that I need and go meet my patient. Hi Jose, it's Tawny again. The doc has asked me to come in and take that catheter out for you today. Can you tell me your name and date of birth? And he tells me his name is Jose Cuervo and that his date of birth is 9/16/1995, and I can verify that on his wrist. I also verified that he's not wearing an allergy band, so he has no allergies. I'm just going to do some quick assessments and quick vitals here, Jose. I'm going to check his input-output, and it seems to be pretty good. The catheter worked very well. I'm also going to palpate the bladder. Oh, that feels much better than it did the other day, so that's very good, Jose. So I'm going to go ahead and ask his family to exit the room, and I'm going to close the curtain for privacy. And now I'm going to go ahead and raise the bed up to a comfortable working height for me to promote good body mechanics and keep me from straining my back or risking any kind of hurts. Okay, this is going to be kind of similar to when we put it in, Jose, but we're going to go ahead and remove it. It's going to be a little uncomfortable, but it shouldn't be painful. So I'm going to go ahead and lay it back. Okay, Jose, just hang tight. At this point, I'm going to go ahead and wash my hands. And I'm going to put on my gloves. And how did everything go with that catheter, Jose? And he says it seemed to go fine. He didn't have any problems, so that was good. Okay, Jose, I'm just going to pull this blanket down just like before, and I'm going to raise up your gown here. I know it's kind of chilly in here, so let me get you covered up there. And so the first thing I'm going to do is lay down a blue pad. I'm going to have him just kind of bend his legs without taking his leg off. Try not to do that to the patient. That's mortifying. And I'm going to go ahead and lift up your bum, Jose. And he's able to do that fairly easily. If he wasn't, I would ask for help. And so get that blue pad there. And now I'm going to go ahead and get the rest of my supplies ready here. So I'm going to go ahead and get a biohazard bag and place it down here at the end of the bed. And the first thing I'm going to do is real quick with my warm soapy water. Jose, you're going to feel me touching you. I'm just going to clean around the urethra and around the end of where that catheter is inserted and make sure there's no discharge coming out. And just give him a real quick clean up here. So, because we are removing a catheter from inside, so we want to make sure it's clean of bacteria there. And once I'm done with that, I'm going to go ahead and deflate the balloon. I checked beforehand, and it said in the chart that he had 10 cc's of fluid in the balloon, so I want to be sure and remove 10 cc's of fluid out of the balloon. Okay, a little pressure here. Go ahead and take a deep breath for me. Bear down just a little bit, Jose. And he does, and the catheter comes out nice. So I'm going to go ahead and untape it from his leg. And I'm just going to wrap the catheter up. And lay it there for a moment. And to finish off the procedure, I'm going to go ahead with my warm soapy water, and I'm just going to clean you up thoroughly now. Okay, Jose, you're going to feel me touching you. So I clean around the end and make sure that I get any of the discharge and any of that extra jelly that has come off. and clean him up real good here. And if he is uncircumcised, I would have retracted the foreskin and cleaned in there very well. And then before I'm finished, I'll place it back in a normal position. And once I'm done, before I take off my gloves, I'm gonna measure the amount in the catheter in the collection bag, and it looks like there's about 600 cc's. So I'm gonna go ahead and I'm going to empty that out and place it all in this biohazard bag. And I'm going to go ahead and remove my gloves and dispose of the bag in the biohazard bin. And once I'm done, I'm going to go ahead and wash my hands. Jose, I'm all done now. How was that? Make sure everything's okay. And just let him know, Jose, for the first couple of times you void, there's going to be some irritation there and some burning. That's kind of normal. If it's persistent, you should probably let your physician know. And also get a hold of me the first couple times you void, and we'll go over that and make sure everything's okay. So I'm going to set him back up in a sitting position. And how are you doing now, Jose? And he says he's doing fine. He feels better, like the catheter did what it was supposed to do. So with that, I'm going to go ahead and grab what's left of my supplies, lower my patient's bed back down to a safe level. Okay, Jose, I put your call bell there. You just let me know if you need anything. And I'm going to go ahead and exit the room. I'm going to let the family go back in, and I'm going to go ahead and document it. And I'm going to document the time and date that I removed the catheter, that I removed 10 cc's from the balloon, and that there was 600 cc's of urine in the collection bag at that time.